Hi, my name is Kristen Buttari. I am from Willoughby South High School. I will be an upcoming senior this year. I was in the nursing internship program this year, and my project is Predictors of Patient Readmission to Hospital Within 30 Days of Discharge. Readmission rates have been a huge problem in hospitals for years. Medicare readmissions cost $17.4 billion annually. 1/5 of all Medicare patients are readmitted within 30 days. Half of these patients do not have a 7-day follow-up with their physician. Starting in October 2012, Medicare will no longer pay for preventable readmissions, especially those for heart failure and pneumonia. About 19% of all hospital stays are due to Medicare patients who readmit within 30 days. Most of them are age 65 and older. Hospital readmissions can be better understood and managed by analyzing the following: where the patient came from, what the diagnosis is, and if there was a 7-day follow-up with the doctor within 7 days of patient's prior discharge. An outcomes review system was created that generated surveys for all patients who readmitted within 30 days. The questions in these surveys include if it was a planned or unplanned readmission, if it was unplanned, why, if there was a follow-up appointment, and what facility the patient came from. Exclusion criteria included any patient who readmitted for chemotherapy, delivery or birth, dialysis, radiation therapy, or rehabilitation. The outcomes review system generated surveys for 212 patients. 99 were females and 113 were males. This data shows that gender is not a factor in readmissions. The population was close to half males and half females. Out of these 212 cases, the average age was 65 and the ages ranged from 0 to 96. This data also is significant in showing that all age groups are admitted to the hospital, and that the 70 to 89 age group occurs most often. This graph shows what facility the patient readmitted from and how many of the patients who readmitted are from that facility. In the pink is home health care, in blue is SNF, which is skilled nursing facility, in yellow is hospice, and in blue is home. This graph shows that readmissions by diagnosis in the East Region hospitals. You can see the percentage of readmission rates for each top 6 diagnoses at each facility and how often they reoccurred at the hospital. This graph shows patients' 7 days follow-up appointment status. In the blue is the patients who occurred, patients who had their follow-up appointment that occurred. In the teal are patients who had no appointment scheduled, and the green is unknown, and the pink is patients who have been readmitted prior to their follow-up appointment. It was thought that there would be a much higher readmit rate from skilled nursing facilities. Also, a much higher rate of non-occurring 7-day follow-ups was expected. Unexpectedly, patients who went home and had a 7-day follow-up had a high readmission rate. Patient education at time of discharge needs to be evaluated. Hillcrest readmission rate, 12.3%, is much lower than the national average, 20.4%, but there is still room for improvement. Hillcrest Hospital is in need of adopting a new discharge education program. A program like this could have a significant financial impact. $2.45 billion could be saved nationwide by 2014. By 2019, $8.43 billion could be saved. It is recommended to repeat the project, expand the sample size, and lengthen the time allotted. Obtain more information from patients about prior discharge education, enhance programs such as ESON and My Practice in order to better understand patients' diagnosis and discharge disposition. Also, evaluate the discharge instructions given to patients and start a new program at the hospital such as Project Run, RED, or AF4Q, which is Aligning Forces for Quality. Both have already reduced readmissions nationally. Evaluate and educate skilled nursing facilities staff further to better understand programs, especially ones for heart failure and other special needs patients. I would like to thank Patricia Gant, Colleen Royer, the Office of Civic Education Initiatives, Nedra Starling and Rosalind Strickland, Jean Sorrell, Molly Lonely, Sarah Sharippa and Melanie Rosenberg, and the Case Management Department at Hillcrest Hospital. Thank you.